I would like to welcome Mrs. Nour Abdelmalek from Saudi Arabia. Mrs. Nour will be talking about nurses in mass gatherings. Just a bit of introduction. She has recently been appointed as the Director of Training and Developmental Department, and she was involved in a variety of fields, including research, health, risk assessment, the Olymoc's health risk assessment, developing and supervising training course, event planning and organizing, project management and supervising and editing newsletter and health promotion material, as well as supervising and editing the development of the GCMGM website. She is interested in the quality of healthcare services provided within the country and public health, including health promotion and health education, as well as social and behavioral change. Thank you very much for joining us today, and you can start your presentation. Thank you.
Good afternoon, everyone. I'm sorry, I'm having a trouble with my laptop. So I'm very delighted to be part of this conference.
There's some background noise. So maybe you have two phones. Maybe you have your phone and your computer on. So maybe you should just reduce the volume of one of them.
No, I don't. That's fine.
No. So you can put off the phone or the volume of the phone and just leave the one on the computer on.
I don't have the phone on.
I don't know. There's a background double noise. I don't know where they're coming from.
Is everyone having the same problem?
Yeah, but let me ask, is anybody having the same problem? Oh, it's an echo. Maybe if you have an headphone, you can use an headphone. If you have an headphone, you can use an headphone, or otherwise, I don't know. Now you have to unmute yourself again. We are not. Okay.
Can you hear me now?
Yes, we can hear you.
There's still an echo?
Alaikum salam. But it's still with this, yes, we can hear you. It's a bit better. You can carry on.
Okay, maybe the connection.
Thank you. Thank you very much.
So unfortunately, because of the COVID situation, we could not meet in person. So with a very short introduction about myself, the past 18 and a half years, I've been working as an emergency nurse, public health nurse. I worked as well as in risk management, variety of research, and as well as quality and training. Why mass gathering? I work currently in the Mass Gathering Center, one of the WHO appointed mass gathering center in the Kingdom of Saudi Arabia. Why mass gathering now? And why it's very important for us in such an event as nursing or in the healthcare system conference. Mass gathering medicine is a new medicine that not everyone is understanding it, or not understanding it, but understand the importance of how crucial it is for both nursing and medicine or physician. Mass gathering through the years, there was a lot of debate between either is it by the number of population, or is it the circumstances or the event that surrounds the event itself. Finally, the WHO decided to.
Do you have an earpiece?
No.
Do you have an earpiece? Okay.
No.
Yeah, okay. We just need to get this, really. Anyway, thank you very much. You can continue.
So the WHO defined mass gathering as any event that will have a number of people attending that will cause or stretches the medical resources of the country. So what does that mean? Will it be a music concert like going to the mall, a very crowded mall? Or will it be a refugee compound or a camp, like going to a hiking camp? So these things was a debate, and that's why the WHO definition was much wider and more specific in the understanding of affecting the medical resources of the country or the local event itself. So why we're talking about medical teams in mass gathering events? Because we're talking about provision of the care to the participant attending the event itself. We're talking about the visitors who's coming. We're talking about the protection of the event itself and the surrounding community, and preparation for any surge to respond to any, la samah Allah, for God forbid, an extraordinary event that would affect the host community itself. So why is that? We know that mass gathering is diverse. It can go religious, it can go to a musical, it can have even the age could affect either their teenager, or their elderly, or their pediatrics or children attending this event. Is it just a religious event? The duration itself, the environment, surrounding environment itself. So there's a lot of factors that affect the mass gathering events in specific and in general. So when we were talking about a religious event in Al-Hajj, it's not the same as a religious event attended by the monks in India, in which the duration is different. Like in Hajj, it's only specific 4 days in a specific place with a specific rituals. The other one is a whole month. They are relaxing. They have their own food. The rituals they can be done in the morning, in the night. But that's why we have to think about these things. When it comes to weather, we're talking about, is it a cold cycle? Is it a heat cycle? We're talking about recreational substances. We're talking about music events for teenagers or up to 40 or 50 years, depends how you want to attend and you're still at your 60s. But I mean, the use of recreational substances during that event and how crowded that event will be. Is 1,000 can cause a stretch on my medical resources, it's equal to a 5 million. So it depends on the town or the country or the local or the host community itself and how it will affect my medical resources. Why pre-event planning? Pre-event planning mitigates my risks. It will help to reduce any future it's not disaster, but crisis or anything that would affect the community and the host and the visitors as well. So preparedness and response must be done to mitigate these risks and reduces the health risk within the event or during the event. So what's the best model? I was happy that my presentation came after the professor's talk, because we're talking about, in general, patient safety. Patient safety, when we talk about patient safety in a hospital, and then we're talking about patient safety in a mass gathering outside the hospital. But within the hospital, I can say I need an emergency, I need this type of nurses, I need this number of doctors, I need this number of paramedics. But in a mass gathering, what's the best model? But till now, unfortunately, there is a debate. There is no proper modeling for a mass gathering event, a specific number or even the type of medical team that need to be deployed in a mass gathering. So then we have two models, the operational modeling and the conceptual modeling. The operational modeling looks at the workload, which is work hours, and the conceptual modeling looks at it in a whole, includes psychosocial, biomedical, everything, and environmental. I could tell in a mass gathering, it depends on the event itself. Either it's in a refugee camp, or it's in a like post-war, or there's a flood, and we're having a lot of patients and victims, and we want to launch or a quick hospital or a quick clinic to accommodate all these patients. We have to look at conceptual modeling because we have to look at it in a holistic way. But if I'm looking like let's say a music event that will stay for 1 day or 2 days, or like a carnival, like gonna stay for 2 days, 3 days, I'm gonna look at it in a less dramatic. So you're the one who you can tell which model you can use. You can even use both. But let's say what the science said. In the medical staff consideration, you have to look at the quality of the medical staff you're deploying, their expertise and the type, the specialities matching the available medical resources and the pharmaceutical resource. What does that mean? It means like when I'm deploying a cardiovascular doctor, I have to deploy him in a cardiovascular department within this temporary hospital. But why would I need a cardiovascular doctor and a music concert? So I have to think about what's the event itself and what is the resources needed to cover these gaps in that event. We're looking at the qualification and the training to immediately respond to the quality to higher level care. What does it mean? Let's say, we have this a concert, or we're having this gathering, and we got an earthquake or a fire or anything, or a terrorist attack. How my team will attack, or my team is my team ready to respond to such crisis? So we need to know. I need to know my staff. I need to know what do I have. I need to know if my staff is up to the limit to respond to such events, either they're doctors, paramedics, or even nurses. We're talking still in general, not talking just specifically about nursing. Other considerations in mass gathering, we have to think about the event dedicated caregiver. That means the people who are working and staffed and stationed in the event. We have to think about the volunteers. If I can have the scouts, if I have medical volunteers or nursing volunteers, they have to be also trained about the basic first aid, or the basic response to disaster or emergency. Also, the unofficial caregiver means, let's say I have, like in Hajj. I'm sorry, I'm getting Hajj all the time because Hajj is very wide and generic, and it has all our expertise there. So let's say people who's coming from Nigeria, and we're having people coming from Egypt, and people coming from Malaysia, and people coming from Indonesia. We're having lots of types of pilgrims coming. Each group has their own man or supervisor, either they are medical or non-medical, that helps them through the journey. our suggestion and recommendation that we are working on is to train these people, the one who's supervising or helping in the journey during their pilgrimage, is to be medically aware with the basic, very basic first aid, such as heat-related illnesses, first aid for wounds, for any injury, even CPR, BLS, basic life support training, so they can instantly help the patient before the ambulance arrives or before the medical team arrives, which will help in reducing the severity of the outcome. So this is what we mean about other consideration. What is the definite number? Will I say 10 nurses, 20 nurses, 10 doctors? How many hospitals? So there was a lot of debate on that. Martin said that it was proven, Martin Gill, it was a study, he said that it was proven that having a physician, a registered nurse, and a paramedic at the side of a mass gathering event reduces the number of patients that needs transferred to a hospital by 89%. Now I will talk about that very shortly later. Mir said medical care team for events more than 1,000 people and crowded away from EMS in a specific location and defined time. But however, no one could say what is the definite number of the medical team. Now, both of them are correct, but for you, who is the registered nurse? Is it me? Is it a clinic nurse? Is it an emergency nurse? So there was a lot of debate in not just the number, it's also the type. How to calculate the number? We have two ways to calculate the number. The WHO uses the Wisen, and the sphere was by the United Nations for the humanitarian and refugee camps. The Wisen, introduced by the WHO, it's calculated using the workload of the healthcare worker and the pressure within the workload pressure within the event. So workload, total vacancies, and total working hour divided by 10,000 as a population. The sphere is a humanitarian, it's more minimal, it's for internal displaced population, refugees, and affected community. The core healthcare worker, so what do we mean by the core health worker? It means doctors, nurses, paramedics, pharmacy and lab technicians are not core healthcare worker. So the core healthcare worker are the frontliner, and then it was calculated by 28.7 divided by 10,000 population. Now, when we're looking about our event, we're not looking about either, it's not a music concert, it's not a humanitarian event, and in the same way, it's not like a temporary for 1 year, because Wisen was used for hospitals that can stay up to 1 year, temporary hospital. So can we use both? Can we merge them both? It depends. Depends on the event itself. I apologize if you can hear my kitten. She wants to go in. If she went inside, it will be a disaster. So why do we need that? The future goal, why we need that. In 2017, UN population report indicates there is an increase, an 8% increase by 2030. This means we need to start building our capacity based on this growth of population. We're talking about 1.9 billion person in 2050. Allah and God give us long life, inshallah. We're talking about building a capacity of a whole nursing and doctors and paramedics that can fill this not gap, but at least fill the needs of these events and the future events. Now, nursing in mass gathering. It is a fact there's a crucial need for nursing in mass gathering. Why we're saying that? We're saying that nurses are the frontliner. Yes, doctors are very crucial, but let's be more honest. When I used to work in the emergency and the critical care, whenever we have a trauma case or a critical case, who first responds after the patient comes from the triage is the nurses. So the patient is there, we hook him to the monitors, two IV cannulas is inserted, everything is ready, the doctor comes. Or either we shout for the doctor because the doctor is busy with another case. So why nurses? Why the nurses need to be up to notch? They have to be very critical thinker. They have to be, as the professor said, they have not sleepy. There is no an emergency nurse that is sleepy. We have to be awake all the time, a critical thinker all the time. But when we're talking about mass gathering, do we need that in a mass gathering event as well? Or is that enough? Does she need to be only an emergency nurse? There was no enough evidence on the criteria and the type of nursing in mass gathering other than being trained to an emergency nurse. Unfortunately, one of the stories that I would like to share when we were in one of the mass gathering events, that one of the nurses that was deployed in emergency, because they pull out some nurses from other from many places, and she was not well trained emergency nurse. And when I say not well trained emergency nurse, I mean she's not trained to be a critical thinker. She's not trained to be highly qualified in an emergency. And I'm not saying this in a bad way. I'm saying it's not her fault. It was the fault of the person who deployed her to be in such events that needed specific and high qualities of a nurse in a medical system. Due to her shortage in her expertise, because she was a new graduate, she wasn't working in an active emergency department, because she worked in a very quiet area, so she did not have enough exposure to critical cases. A little confusion in the team when we started having trauma cases coming to the department. She started crying and she collapsed because this is the first time for her to attend such events. So who to blame? Will I blame her because she doesn't have enough expertise? Or will I blame the nurse manager or the supervisor who deployed her? I don't know who will blame. So, nursing in mass gathering. It was suggested that advanced practice nurse at such events reduces the ambulance transport and referrals to external resources such as hospitals. Advanced practice registered nurses are registered nurses with more advanced education and training and certification that allows them to provide more complex care. We're not talking just about ALS or ACLS or BLS, or we're not talking about pre-hospital, just pre-hospital training. No, we're talking about higher diploma, masters, PhD, more specialized training. There was an unpublished project concluded that having an APN or a physician assistant at a community care unit and reduced or redirected 57 like more than half of the non-urgent visits to the ER. And we're talking about, that was the debate in a lot of, I don't know if this is the problem globally, but we have this problem here in the kingdom and a lot of Middle East countries having a public, an advanced practitioner, nursing practitioner in a community care center or in a healthcare center that could replace a doctor. We're not talking about replacing the doctor, we're talking about prescribing medications that could be prescribed easily, such as flu medication, cough medication, and we're talking about high-level registered nurses. We're not talking about basic bachelor degree registered nurses. That lowered almost 60% of the non-urgent cases to the hospital. So I think in New Zealand and Canada, there's a lot of places that they already, if someone can correct me in that they are already having APN working in community care centers. That we can keep it to the end if anyone has an answer for that. But I do believe that having an advanced practice nurse in a community care or in a mass gathering event is very important, which will reduce not just the pressure on hospital, it also will reduce the pressure on the doctor, because we're not going to have like 3, 4, 5 doctors in one event or in one clinic. But if I have 2 or 3 advanced practitioner plus 2 doctors or 1 doctor as a consultant, that will help a lot. Why nursing in mass gathering? As we know, each event is unique, and planning and preparation is very important in such events, because it minimizes the risks and mitigates the risks during and after. There is a high workload, high turnover for patients. Patients who could be drunk, patients could be high, patients could be tired, patients could lost their medication or forgot to take their medication. Many considerations should be in mind during planning a mass gathering event. So language barrier, medical seeking behavior is different, diversity in patient culture, nature of disease, also temporary setting, because the environment is different. I work in a hospital, she works in a center, she works in a big city, I work in a small city. So even the environment for the team is different. When they conjoin the team, the doctor comes, let's say, from Riyadh, the nurse is coming from Taif, so different cities. I'm dealing with new people. So the harmony between the team is different. It's not like working with the same team for the past year or 2 years. It's a different environment. Working under spotlight and stress, like what happened with that nurse who collapsed because she's an emergency nurse, and everyone is looking at, they're looking at her to be very fast and quick, and that was the first time for her to work in such situations, so she collapsed. So this was also one of the challenges, lack of training and experience in disaster. It's very important to have such training and experience in mass gathering, because we never know what will happen during such event. Lack of knowledge and information in emergency response, not assigning the right profile to the right task, as I mentioned earlier, or having the cardiovascular doctor in a mass gathering event. Why would I have that in a small clinic?
Thank you very much for joining us. If you can just plan to conclude.
Half an hour already.
Yes, almost.
Really? We can
Yes,
speak all the, you can have after hours.
that's the way it is.
5
It's
more.
about 5. Yeah, let's say 5 more minutes.
Yeah. So,
No, it's a
how
very
to
interesting talk. Yeah, I even
Yeah, no
I've
problem.
enjoyed it. Thank you.
Now, how to overcome these challenges. Disaster education and training courses, also simulation, field training and exercises. Put your nurses and put your medical team every now and then in drills and simulations. Let them get trained every now and then in case of any disaster happens. Postgraduate studies on disaster response in mass gathering. There is a lot of online courses that concentrates and focuses on mass gathering and response in mass gathering. Auditing the clinical performance and knowledge as yearly competency. Make it a competency, not just an emergency, just not only an emergency department, just make it for the whole hospital or your whole team. So whenever you deploy from any department, they are ready for emergency and disaster response. Supervision and support of the team leader manage during and after the event. Unfortunately, this is one of the things that I wanted to do my master degree, my thesis on, is the emotional support for the medical team during a disaster in a mass gathering, during and after. Unfortunately, there is not enough support for your medical team during the event because everyone is busy, everyone is tired, and everyone wants to do everything. I don't want to go to sleep. I just want to go and work. How my friends are and colleagues are responding to the team in that shift, and I'm going to go and sleep. So the supervision is very important. As a supervisor, I have to make sure that my team is relaxed. My team is doing their 12-hour shift. Let's say, Amal, خلاص, you finished your 12-hour shift, you go sleep. You go have a snack. You go have your break. So we make sure that the team is very comfortable. I have to make sure that emotionally they are very comfortable. Debrief with the team, what happened. Do not blame anyone for any mistakes during the event. Unfortunately, what happened to that nurse, because the head nurse confronted her in front of everyone, that's why she collapsed and she cried and she felt very unqualified and embarrassed. I felt very bad for that nurse because her head nurse should have taken her later on and debriefed her by herself, because it was a very small, everyone was there. The head nurse, the doctors, the consultants, people from outside. So imagine how she felt emotionally, not just for that day, for the coming days. Like she has a 5-day event, how she will even perform after that. So it's very important to supervise and understand the emotions and the stress that the team is going through. I'll have to talk about this very quickly. We spoke about it, that there's no standard. Our recommendation, due to our expertise, I'm not saying that this is just a recommendation, just a suggestion. We can keep it for later to discuss. That we must have experience in mass gathering, at least 2 years, experience in emergency. She must have experience in emergency response planning. She has to have, or he, certified in emergency, pre and in-hospital emergency, just ACLS, tactical, operational, and strategical level. There is also received training in HRI management, clinical thinking, and critical thinking, as well as epidemiology and health information system. Final consideration: always be prepared for the unusual. Think ahead. Stay calm. Do not get stressed. support your team, react to patients calmly. Patients who's coming to the event, it depends on the event, the type of the event, who are they? Not usually they're talking your same language, not usually understanding what you're talking about. So they have to be very calm. Go back to basics. If you forgot about everything, go back to ABC. Always trust your instincts. They always say nurses have their sixth sense. When you feel something is wrong, you go report it, or you go and discuss it with your higher manager, with your head nurse, with the doctor, whoever. Always debrief yourself and the team. Always sit with yourself at the end of the shift. What did I do today? What have I done with this patient? Did I do it right? Did I do it wrong? Discuss it with your friends, with your colleagues, and with your whole team. So that was the final slide. I hope I finished it very quickly. Is there any questions?
Thank you very much for that educative, inspiring talk. I mean, it's
yes, thank you so much. This picture was taken in one of the music concerts before the COVID. That was in January 2020, before the COVID starts. And I was in between those people. This is in Riyadh. So I wanted to capture for you the crowdedness of the people and how hard it is for medical teams to respond for any case inside. But the people who was responding was the volunteers.
Yeah, thank you very much for that. They're quite interesting slides and interesting talk, and alhamdulillah, and that's very good. It's a very interesting episode. Thank you everyone for joining us. We're still on our second day for our conference. You can see that we have got amazing speakers, inspirational speakers, with different topics that can impact our lives and support us as healthcare professionals. Thank you very, very much. If there's no question, if 1 minute question or comments, there's no question, there's no comment. Thank you for an informative talk. Thank you very much. Good. We still have time in the afternoon for questions and answer, and we can take questions after then. If you have any